Hello everyone, today we are going to talk about corticosteroids, which are potent anti-inflammatory drugs. The drugs included in inhaled corticosteroids are beclomethasone, budesonide, mometasone, fluticasone, flinosolide, and cyclisonide. Oral corticosteroids are prednisolone, and dexamethasone, where systemic corticosteroids are methylprednisolone, hydrocortisone, and dexamethasone. When we talk about the mechanism of action of corticosteroids, we all know that arachidonic acid is released from the membrane phospholipids with the help of the enzyme phospholipase A2 that is basically inhibited by corticosteroid. Normally, arachidonic acid is converted to prostaglandin and thromboxane by cyclooxygenase pathway and through lipooxygenase pathway into leukotrienes. So basically we have two pathways, COX and LOX. These mediators are not generated when corticosteroid therapy is initiated. The main side effects of corticosteroids are hoarseness of voice and oropharyngeal candidiasis. It happens because corticosteroid just suppress our immune system and allow the fungus to grow. And we can prevent candidiasis by gargling after each dose, and if it happens then we have to use topical nystatin. Systemic corticosteroids should be avoided in pregnancy, but inhaled steroids are safe one, and especially cyclisonide is an inhaled corticosteroid which is metabolized by the enzyme in the lungs. Thus, it has least risk of toxicity from the systemic absorption when given inhalationally, and we call it as soft steroid. It is important to remember that if we are giving corticosteroid orally or systemically for short term, then there is no HPA axis suppression. But if we are using it for the long term, then HPA axis suppression can happen. So we have to taper the dose, we have to change the dose. For the short term, it will not happen, so no need to adjust the dose. To get more knowledge, stay tuned with us.